when a patient comes in and we're done with the appointment, they go home, one of the first things we do, we give them a new toothbrush, toothpaste, and floss. And if you're a little kid, we'll give you some stickers as well. And we always to make sure that you do brush and floss at least once a day. It's supposed to be twice a day. But if a patient comes in saying, oh, I don't do it at all, if you do it once a day, is much, much better than nothing. I always tell my patients that the best way to know to change a toothbrush is when all the bristles start going all sideways. You're supposed to change it every 3 months. That's what everybody says. But if the bristles don't look good, then you got to change your toothbrush. But if your bristles don't look pretty a month after you started using that toothbrush, then you're not brushing good. You're brushing way too hard. We got to lighten up on that brushing. And one thing also, the toothbrush collects a lot of germs while it's sitting in the bathroom. So you should always keep your toothbrush inside some kind of casing to protect from all the germs that happen in the bathroom. Usually they sell, even at the dollar stores, little packets that go over your toothbrush head. So you just put your toothbrush inside that, stick it in the bathroom drawer, and you should be okay. If you have an electric toothbrush, they already have special casings and special stands for you to put your electric toothbrush heads in it, which is a very good option. And getting an electric toothbrush is usually highly, highly recommended to a lot of patients.